Thank you, everybody, for joining us today. This is our second lecture in our geriatric resource course. There are a few people who weren't with us last week just because we were getting started. So just as a little bit of a background for those people, the purpose of our course is really to increase awareness about common issues that impact older adults and make you more aware of some of the resources that might be out there in the community to deal with some of those problems. So basically, to do this, we've got this 11 lecture course that you're now a part of. And so there's like a 1 hour lecture followed by a half-hour discussion. That's the format we're using. And, we encourage you, if you were here last week, we're encouraging you to participate, to share your perspective, to share your knowledge. As we were just talking, you always you get a group of people together. There's always somebody who has a resource or some knowledge or situation that is informative for other people. So we truly do encourage you to participate in that discussion. And again, we are not trying to turn you into geriatricians or any other sort of expert, but what we really would like is that through the knowledge you gain in this course, that you'll be able to go back into whatever environment you're in, whether you're in a community-based, whether you're in a healthcare environment, you'll be able to go back into that environment and maybe be a little bit more able to recognize issues that maybe you could help out with, or maybe there's some resources that you'll be able to refer people over to. That's our ultimate goal, is just to increase that awareness. So and before we begin today's, just so if you have any technical questions as far as how the course is run, or if you have questions particularly about the course itself, we will, after we're done with today's discussion, be available to answer those. So we'll hold off on all of those sort of things until then and help you at an individual level. And again, we're always here to help, so please. And also, we're really so happy that some of you were able to join our echo yesterday. Remember, everybody needs to do one. I think if you would agree, yesterday's echo was really, really good, really informative information. And then you're also required to do one CMIT, which several of our people were able to do today. And as you heard me talking with Terry, it was a really great case. So, but again, one is each of those. So I'm going to turn it over to Brandy now. Brandy is from the Area Agency on Aging in the Akron-Canton area. And she is going to so last week we talked healthy aging. She's now going to present the social determinants of health and how important they are to consider in healthy aging. So take it away, Brandy.
All right. Thanks, Sue. So I'm Brandy Krzyzanowski. I've been with Direction Home, Akron-Canton Area Agency on Aging and Disabilities, really super long name because we do a lot and it's really hard to come up with like a name that reflects everything that we do, which you'll see here shortly. But we just kind of go by Direction Home at this point. But I've been with the agency for 19 years, done a lot of different things. I was a case manager, so I've been out in the field. I've done transitions, assessments, all different kinds of things. So today we're going to talk a lot about like resources, the different things that Area Agency on Aging have to offer. And then we'll talk a lot about social determinants of health and, kind of how they affect people's well-being. So let me share my PowerPoint here. I'll definitely leave time at the end for questions, but if you've got a burning question along the way, definitely just interrupt me. I'm not opposed to that. All right, so just in case you're not familiar with Area Agencies on Aging, so we're federally funded and mandated. So area agencies came out of the Older Americans Act in 1973, and there are currently about 622 area agencies across the country. So every state has them, every county has an area agency that covers them. But we like to say if you've seen one area agency on aging, you've seen one area agency on aging. Even though we get a lot of similar funding for similar types of programs, that's just like a little bit of what we do. The rest is, kind of different among each AAA. And I think Michelle told me that there are some individuals who work for different AAAs that are on the call. So some of this will be familiar to you and some maybe will be a little bit different. But some AAAs in other states, just do information and referral or information and assistance. Some only do care management. Within Ohio, all of the AAAs do both. And there are 12 AAAs in Ohio. So my particular AAA, Direction Home Akron Canton, we cover Portage, Stark, Summit, and Wayne counties. We're a private nonprofit. We have a board of directors. We have about 230 staff members, quite a few volunteers, and then service providers. We have, I need to update that. I think I just ran a report last week and it said 352. So we have quite a few service providers, and those are the companies that we contract with to provide services for people in the community. And then we serve a little over 7,600 individuals on our various waiver programs. So we'll talk a little bit about waiver and what that means in a little bit. Here's our mission and vision. So, you know, forever we were called Area Agency on Aging, but because we actually provide services for individuals of all ages, across the aging spectrum, we have babies, you know, provide services we provide for babies and for teenagers, you know, the whole gamut. So we didn't want to change the Area Agency on Aging name because that's been a known name for almost 50 years in the community. But we wanted to, you know, make sure that people were aware that we do have services for people who are younger as well, especially those with disabilities. So at the bottom there, you'll see our little tagline. That's kind of what we tend to quote, is that we provide choices for people to live independently in the place they want to call home. So that is our overall overarching goal. And that's why we added Direction Home to the name, because truly that's our passion, is just to make sure that people are living in the place that they want to call home, and that they have the services and the supports, and that they are being safe and healthy as long as possible. You know, I would say the vast majority, of people probably wouldn't say that their goal is to live in a nursing home. There are some, I have definitely met some who love it, and that's great. And there's definitely a role for nursing homes in the community. They're definitely a needed entity. But I would say most people probably, that's not their goal, is to live there. So if there's any way possible to get them into a little bit less restrictive environment, assisted living, at home, whatever, that is our goal, to help them get to that environment and then provide all of the wraparound services to make sure that they're safe. So another, you know, little slide about who we are. So the majority of our staff are nurses and social workers. We also house our ombudsman department, which is a little bit different. Not all AAAs have their ombudsman department like within their Area Agency on Aging. Some are standalone separate entities. An ombudsman is someone, if you're not familiar, who goes into nursing facilities and acts as an advocate, acts as a voice for residents of nursing facilities to make sure that their rights are being upheld. If there are any issues or they have any complaints, they'll encourage the individual to, you know, maybe handle that on their own. And if they're not able to or not willing to, then the ombudsman will kind of step in and do what they can to be a voice for that person. We have a dietitian, a lawyer on staff, and then of course, like any other business, we've got some of those backroom services like HR and finance and things like that. This is just a little services wheel, just kind of shows you a little bit about the services that we offer. I'm not going to go into detail on each of these because I have some slides a little bit later that will, but just so you know, kind of our overall core services, we have the home and community-based services. We have a really robust nutrition program. We have a caregiver support program. Our front door, or it's also called Aging and Disability Resource Center, is, you know, the information and assistance where people can call and ask questions and get, you know, schedule their in-home assessment, things like that. And then our Elder Rights Department is where the ombudsmen are housed. And then we have quite a few health and wellness trainings that we offer. So a little bit about kind of what we do each year. We generally average around 12,500 calls per year where we provide information and assistance to the caller. We have a transitions program where we help 11,000 Medicare patients avoid readmissions. So once they've been admitted to a hospital, we kind of get involved and we do some health coaching and some follow-up to help avoid readmissions within the 30, 60, 90 days of discharge. And then we generally assess around 10,000 people in the community. And the assessments can occur anywhere. It can be, in an apartment, it can be in assisted living, a group home, a nursing home, our assessors will go kind of wherever that individual is to do that assessment. I think we've even done them in homeless shelters. So we kind of follow the person. And we have 210 nursing facilities that our ombudsman kind of cover, that there's an ombudsman assigned to each of those facilities, to kind of make sure, again, that those needs are being met with those residents. We provide continuing education trainings, classes for individuals, usually who are nurses and social workers in the community, and usually about 4,000 people attend those trainings each year. And then with our evidence-based courses, we've been providing around 60 or trainings to at least around 60 individuals. This is a little snapshot of some of the programs that we offer. So as you can see, the CareSource program has the majority of our consumers currently. There's a little over 2,000 individuals that we case manage who are on the MyCare Ohio waiver with CareSource. The next would be United, then Passport. So you can kind of just see how many individuals we have on each of those programs, which again, I'll talk a little bit more about in a few minutes. Our provider networks, we have, like I said, I think it's 352 now contracted providers. The majority of those are home health agencies. We also have, quite a few minor home modification providers, meal providers, all that kind of stuff. All right, any questions? I see something in the chat. Oh, no, we're good. Okay. Any questions before I kind of get into the nitty-gritty about the services? I just want to take like a second here so that, if there's any questions, I'm not talking over people, but okay. So these are just alphabetical, but so our Aging and Disability Resource Center. So what they do is individuals will call in, they'll ask, questions. It might be the individual themselves saying, I'm struggling, I can't pay my rent, or I don't know where to go for food, I ran out of money, or whatever. Or it's a family member or a friend calling and saying, I'm really concerned about, my family member, they, don't seem to be taking good care of themselves, what options are there? So we have individuals who provide free information over the phone. If it sounds like the individual would really benefit from having an assessment, then our Aging and Disability Resource Center will go ahead and schedule that in-person free assessment to kind of go over like what the needs are, what's available, things like that. We have an Alzheimer's program and a family caregiver respite program. And these are for individuals who have Alzheimer's or related dementia and have an active caregiver. And then we also provide services for the caregiver of those individuals. The care recipient has to be over the age of 60. And then the things that are available on these programs are personal care services, some minor home modification. We link them with a case manager, homemaking services, adult day services, and transportation.
Are there financial limitations to that program?
I believe so, but I don't know that offhand.
Okay.
I was just, as I was saying that, I was like, I wonder I should find that out. So thanks for that, Sue. I'll make a note to have that for the next talk.
Sure.
Okay. So assisted living waiver. This is for individuals over the age of 21 who are eligible for Medicaid. And just because I'm not sure, I should have probably asked ahead of time, who all was on the call and kind of where your where you are with, your knowledge of like Medicare and Medicaid and all that kind of stuff. But because that's one thing that trips people up a little bit. So Medicaid is for individuals who are low income and also have some kind of need physically, like they need help with either bathing, dressing, transferring, feeding, things like that. And if you're eligible for Medicaid, you're eligible for quite a lot of services for the length of time that you're eligible for Medicaid. So if you continue to have a physical need and you continue to be low income, you would continue to receive services. Now, Medicare is mostly for individuals over the age of 65, and it's not related to your income or, really your need. Some individuals under the age of 65 qualify for Medicare, but it's usually because they have a disability. So I just want to make that little bit of a distinction. So the majority of our programs are going to be Medicaid eligible. So they have that low income and have that physical need. So for assisted living, as long as you're 21 or over, eligible for Medicaid, you would be eligible for the assisted living waiver. And what that provides is, of course, the room and board, all of your meals. They help with medication administration. There's a case manager for each individual who's on the waiver in assisted living. And then also what's a really kind of neat part of that program is if an individual is in a nursing home and wants to move into assisted living and they don't have anything, maybe they lost their home and don't have any, a bed or furniture or whatever, there's a piece of the assisted living waiver that's called community transition services. So the assisted living facility will go out and purchase, some, furniture and, if they want dishes or, whatever it is. I think it's $1,500 that they're able to spend to help kind of get them set up in their new home. Assessment and consultation, talked a little bit about this already. It's, it's a free in-home consultation for anyone, just kind of seeking to receive information. A lot of times we're helping people to plan for the future. A lot of times people will contact us and they say, I don't really need help now, or I know I don't qualify for things now, but, can you help me kind of plan for the future? Can you tell me what I need to do, in order to qualify? So we do a lot of those, long-term care planning visits as well. Our care coordination program is the one program that we have that is for individuals who don't qualify for Medicaid. So maybe they have a little bit too much money, or they just need help with like one thing. They don't need help with, 2 or 3. So they don't qualify for a waiver. So it's the same type of services. They still receive a case manager, the in-home services like personal care, home delivered meals, things like that. But it's a very small program. There's not a whole lot of funding for it, unfortunately. There's around 300 individuals on the program right now, and the waiting list is at like 600 or 800, unfortunately. And we'll talk a little bit more later about, the reasoning behind this, kind of big gap in service. So as far as our educational classes, we have Healthy You and Steady You workshops. We have chronic disease self-management, diabetes self-management, matter balance, and Tai Chi. These are really awesome and fun programs that before COVID were all in person. Anyone over the age of 60 who was interested in the community could attend one of these workshops for free. We got so much great feedback that people would want to, go multiple times to the same class. The class would be 12 weeks long. As soon as 12 weeks was over, they would say, "Can I sign up again?" I used to teach a couple of them, and they just were really a lot of fun. COVID changed things a little bit, and thankfully during the pandemic, the state allowed us to do these virtually. We were afraid that we wouldn't have as many participants wanting to do it virtually. We weren't sure, do people have computers? Or do they, know how to get on like a Zoom call? Are they going to be comfortable doing this? And with just a little bit of upfront, help training to get people on, we ended up with really great results, and still were able to provide these trainings to just as many people as we did before the pandemic. So that was really kind of great. We're still doing everything virtual, but at some point we're hoping to get back into person with all of these classes. And just a side note, if you're somebody who would love to be a trainer for one of these courses, definitely, reach out to me. I can link you with Lori, who's our training coordinator. We're always looking for lay leaders for these classes. So let's see. All right, long-term care ombudsman program. Spoke a little bit about this earlier. So individuals who are in nursing facilities or assisted living, our ombudsman will go out and visit with them, make sure that they're, happy where they are, that they're being taken care of, and things like that. My Care Ohio. So this waiver program is for individuals who are what we call dual eligible. So you have to be eligible for Medicaid and Medicare. So you've got to be, either over 65 to be on Medicare, or, younger with a disability. And then you have to be low income and also have that physical need. So My Care Ohio is kind of a newer waiver. It started, I forget how long ago now, 6 or 8 years ago. But lots of services that are available through that program. It's for individuals over the age of 18, as long as they're, Medicare and Medicaid. They receive a case manager, all those in-home services that we've kind of been talking about. And then there's the Ohio Home Care Waiver, and this waiver is for individuals under the age of 60. So 59 and younger have to be on Medicaid, and you can see kind of the list of services that are available on that waiver. And then this is the last one of all of these waivers slides. I know it's a lot. Passport waiver, this is the one that we're probably most known for. We've had the passport waiver. AAAs have done passport for the last, I don't know, 40 some years. So usually when you think Area Agency on Aging, you think passport. And this, because it was our original waiver, and it's for individuals on Medicaid over the age of 60 with a huge plethora of available services. So a lot of times what we're seeing now is people will, sometimes graduate through the services. They might get on the Ohio Home Care Waiver when they're younger, move into passport as they get over 60. And then as they become eligible for Medicare, then they switch over to MyCare. The nice thing is the types of services that are available are very similar. And we try to make those moves as seamless as possible within our agency. All right, so specialized recovery services. This is a newer program that we've had for a handful of years for individuals over the age of 21 who have either behavioral health or psychiatric diagnosis. And this provides them with a case manager, they call them recovery managers, and a peer recovery support person. And then, this they help with placement, they help with, finding housing and hooking them up with services to support their, mental or behavioral health in the community. A lot smaller of a program, but a really great addition. And then transitional care program is the last one that I'll speak about. I talked a little bit about this earlier with people who are in the hospital who are going, discharging back to the community. Our nursing coaches will go out and meet with them, and they, help them to kind of help people to recognize red flags. Sometimes you find that people are, I hate to say this, but you'll know what I mean when I say it, like frequent flyers. You might have a client who kind of ends up going to the hospital quite often. And sometimes if you can just, get them to recognize some of those signs before it gets too bad, and just say, hey, if you're starting to feel, a little anxious or starting to feel like you're having trouble breathing, contact your doctor, get in to see your doctor right away, rather than waiting until it gets so bad that you need to go to the hospital. So they do coaching events like that. They do a lot of discharge planning with them, and they go over the discharge paperwork and everything with them, and they do med reconciliation and all those kinds of things, and work really closely with their doctors and make sure they schedule those follow-up appointments. All right, any questions? I know that was a lot. What I just want to make sure that is we don't expect you to know all of those things, remember any of that. Really, the biggest takeaway is if you come across someone who you think, wow, they might need some help in the home, I don't know what or if they qualify for anything, just call us or have them call us. And by us, I mean just, the local Area Agency on Aging. We definitely want to make sure that people aren't self-selecting themselves out thinking, oh, well, I might not be low enough income, I probably don't qualify. Just call. It's a free call, a free assessment. So that's kind of like my biggest takeaway. But I did want you to.
So we will actually put in that. So the first thing that Brandy had on that first slide with the ADRC, that we'll put a phone number up for that. And that's the one, that would be the one to call. We'll put it up for you.
Yeah. And we also will send out the slides. Yeah.
Thank you. All right. I'm going to keep moving here. Oops. So you can't really talk about Area Agencies on Aging without talking about social determinants of health. I know that social determinants of health is, a big focus right now, has been for the last handful of years, but truly that's the wheelhouse of the Area Agency on Aging. That's why they were created so many years ago. So social determinants of health are the conditions in the places in which people live, work, learn, and play that affect a wide range of risks and outcomes. So social determinants of health include social, economic, and environmental factors. And this slide just kind of shows just a handful of some examples of social determinants of health. So things that can greatly affect someone's health or quality of life are things like, not having social supports, being isolated, having low income, low health literacy, food insecurity, things like that. Some of the most common social determinants of health that we hear of or find within our agency is low income, limited education, either unemployment or job insecurity, food insecurity or limited food access, unsafe or unaffordable housing. I always like to tell the story. When I was a case manager, I had a client who was often in the hospital. She had a lot of anxiety and had panic attacks and would think she was having a heart attack and, couldn't breathe. So she would go to the hospital. And after doing this, for quite a few times, we just were, we had a conversation one day where we just were, I asked her a bunch of questions and she just really kind of started telling me about, what the neighborhood was like and how she felt in her home. And come to find out, she lived in a little, in an area where she didn't feel super safe. There was a lot of gang activity going on at the time. And she said because I started asking some questions because it seemed like a certain time of evening is when, she would end up calling and needing to go to the hospital. And what she ended up telling me was that there were a lot of gunshots that were happening as, late at night. And that was, making her anxious and exasperating. She had COPD and asthma and different things. So it really was affecting her health. So what we were able to do is get her moved into a different neighborhood, a different apartment where she felt a lot more safe. And she went for, a year at one point without having any admissions into the hospital. So it was really, really fantastic. And, nothing against the hospital or the doctors or nurses. They did a great job of taking care of her when she was there. But what's hard for them is they don't know what the home life is like. They didn't know that there were these other factors that were influencing her care. So some of the other things are lack of dependable childcare, social isolation, discrimination, and then limited or no access to affordable health services. So why are social determinants of health important? The story I just mentioned, super important, but also what the studies are showing is that only about 20% of patients' health outcomes are actually specifically related to the care that they receive through like the doctor or through the hospital or whatever. And that as much as 80% could be affected by what's going on in their environment. So it's huge. And again, it's really hard when you're seeing someone in an office setting to know what that home, environment is like. So it's really great if someone is actually on some type of program where they have a case manager, because then that person can see them in the home and can kind of recognize some of these issues. So how do they affect outcomes? Just looking at one of the social determinants of health, social isolation. So if you have an individual who lives alone, who's not getting out to see family or friends, has kind of so isolated themselves, they might not be getting up off the couch as often. So they might be limiting their function. And when you limit your function, that can cause pain when you do need to, get up and move around, and pain can cause depression. Or, when you're socially isolated, that can cause depression. And in a lot of people, depression manifests itself as pain. And then if you're in pain, you're not going to get up and move around as much probably. So that limits your function. And, so you can see that it's just like, I call it the cycle of sadness. You can kind of jump in at any point and it moves kind of in any direction, but you can see how just, social isolation in and of itself is already hard, but then, you could have all of these other negative outcomes because of it. So how do you screen for, or how do you know if social determinants of health are an issue, especially if you're, for our agency, it's a little easier for us to know if there are issues and recognize them because, like I said, we're in the homes. We see them where they actually live. But if you're someone who doesn't see them in their home, things that you can do is you can ask questions. There's lots of online screening tools available. But really, I don't think that the question itself or how it, I don't think there's like any one right way to ask the questions, but just asking questions about different things like food. Do you have enough food to eat? Are you ever worried that you're not going to be able to afford food? Have you ever had your utilities shut off, or are you worried that they might be? Are you being, getting those calls or those letters saying that, you're going to get cancellations if you don't pay? Are you worried about how you're going to pay your rent? Do you have any trouble, getting health or getting childcare when you need to go to work or need to go to school? Have you ever not gone to the doctor when you needed to because you didn't have transportation? Or have you ever not gone to the doctor because you can't afford to pay, the out-of-pocket expenses that go along with that? Do you need help reading hospital materials? I think a lot of times at least I don't, I don't tend to think about the fact that there still are a lot of individuals out in the community who are not able to read, or English might not be their first language and they can't read the materials that we give them that are in English. And a lot of times they won't tell you these things, so we won't know unless you ask. Are you afraid that you might be hurt in your home? And this question is kind of a loaded question because it could mean a lot of different things. You could ask, is there anyone in your home that you're worried might hurt you or has hurt you? Like the story I told about my past client, she was worried about people outside of the home that maybe would come in and would hurt her. Or it could be, they've had some falls, or they have stairs, or the home is unsafe in some way and they're afraid that they might get hurt in the home. Another good question is if you are ever sick or if you went to the hospital, is there someone that could help you if you needed to be in bed for a few days? So these are some questions that might not have anything to do with why you're seeing them or why they're in the hospital or why they're in your office. But it's a good way to kind of figure out what's going on in their environment that could impact everything that's going on health-wise for them. All right, so you've met with somebody, asked some questions, figured out that there are some social determinant of health issues. So now what? What do you do then? One thing that you're going to hear a lot about during this geriatric resource course is that we're going to really kind of push working together and the team approach. None of us know everything. We're not expected to. It's just not going to happen. So, really just working with other disciplines and talking about, kind of what available resources are out there is the best way to care for all of our, all of our individuals or consumers. Of course, like I, keep mentioning, definitely call your local area agency on aging. Again, there's one for every county, every state. That's a great place to kind of start to see what's available. The different kinds of services that are available: home delivered meals, personal care, homemaking, transportation, health coaching, medication management, emergency response buttons, chore and homemaking services, minor home modification. There's lots of things available. All right, so the loaded question is, so how are these services paid? If someone's eligible for services or needs some help in the home, who pays for that? And that's the hardest part out of all of this. So this is the part where I say is like the good, the bad, and the ugly. So there was a questionnaire that went out a couple of years ago to the northeastern part of Ohio. Like tens of thousands of people took this survey. And one of the questions was, if you need help when you get older, how will you receive services or how will you pay for services? And 95% of the individuals that took that survey said that I've got Medicare, I'll be fine because Medicare will pay for it. And unfortunately, that's not true. So again, Medicare is for those 65 or older, or you've got to be on disability if you're under 65. People think that Medicare covers all of the things that they're going to need help with, but Medicare does not cover long-term ongoing things like nursing facility care or assisted living or your daily assistance with like eating, bathing, dressing, things like that. And it doesn't cover adult day services. What it does cover is, so Part A covers your hospital costs after you pay a deductible. It covers short-term stays in nursing facilities, especially if you're considered skilled. It covers hospice care, for short-term. Part B covers the cost of doctor's offices and outpatient and other services that A doesn't cover. There's generally fees, of course, that are involved. And then some preventative services like flu shots and diabetes screening. And then Part D covers some medication costs. So it does cover quite a bit, but it does not cover the ongoing long-term stuff that, that a lot of individuals as they get older might need. So if Medicare doesn't cover it, then who does? Obviously, if you are fortunate enough to have a large income or huge savings, you're probably going to have to privately pay for services. The Older Americans Act does have, provide a little bit of funding. Like that's what we use for like our care coordination programs and things like that. But again, there's like waiting lists. It's very small amount of money. Medicaid waiver is truly the program with the most services. If you're low income and need some help, there's a plethora of services that are available. And then some Medicare Advantage plans will cover a little bit as well. Everything is on a case-by-case basis though. Excuse me. So the good is that people are living longer, right? We're living longer, we're living healthier as well. But the bad is if you kind of look at this trajectory, so it goes from the year of 1900 to 2026, and it shows the number of individuals over the age of 60 in millions. So right now we're, just past the 2020 mark, which is 56 million individuals over the age of 65. Excuse me. But if you look from 2020 to 2024, that's a huge jump that they're projecting. And then to 2060, it's almost doubling from where we are right now. So I'm not saying that it's bad that we're living longer. What's bad is that our current infrastructure isn't adequate enough to cover all of the needs that we have now. So if we don't make some major changes, we're never going to be able to provide the service for all of the people who are going to need it, in the future. And why I'm concerned about this is if you look at this slide, it shows kind of the federal budget and where they've been kind of putting a vast majority of their funds. So 2004 is the blue. So you can see on the left that the Department of Defense, they were given $380 billion. And then in 2019, they were given $618 billion. And you can see CMS got a Center for Medicare and Medicaid. They received a huge jump between 2004 and 2019 as well. And I'm not saying this is bad. Obviously, we have to defend our Department of Defense. Obviously, Medicare and Medicaid, super important. But what's bad is if you look over on the right, which is the Administration on Aging or the Administration for Community Living. And these are who, provides funding for the services, in all these waiver programs that I've been talking about. That funding has remained flat. It was the same in 2004 as 2019. So not only do we have, every year we've got inflation, the costs of services, the cost of everything is going up, right? But now we also have the number of individuals who are aging and who are potentially needing services is growing, at a super high rate, and we're not providing any additional funding for services. So that's the big issue that we're kind of facing, unfortunately, at the moment. This is kind of a silly little slide, but I just kind of like to show it just to show you like kind of the breadth of the issue. So if you look on the top left of the broken bridge here, these are the people who I say are like the LeBron James. So they've got tons of money. If LeBron James ever needed help with anything, he's just going to pay for it, right? He's got the funding for it. The people he can privately pay. People on the right of the bridge, these are individuals who are low income. They have very low income. They have a need. There's tons of services available for them. They're set. They're good to go. So people on both sides of this bridge are pretty good to go. There's stuff available for them. But it's the individuals in the middle who actually are the vast majority of the world, really, the moderate income individuals who make a little bit too much money to qualify for Medicaid. They don't qualify for any of those services. They have a little, but they don't have enough money to where they can privately pay, because private pay is really expensive. So that's, the big question and the big issue is, what about these people? What about the people who don't qualify for services? And this is where I put in my little plug for senior service levies. So Ohio has 88 counties. And last I heard, I think 80 counties out of 88 have senior service levies. And what a senior service levy does is it provides services for those individuals who don't qualify for waiver programs. All 4 of the counties in our area do not have a senior service levy, unfortunately. So if you ever see one on the ballot and you live in Summit, Stark, Portage, or Wayne, consider it, because at some point, you know, you or I, or at least a family member, someone's going to need some help. And if they have a little bit too much, you know, make a little bit too much money, or have a little bit too much in assets, or, you know, need help with a couple things, but not quite enough, there's not going to be anything available for them, and they're going to have to figure out what to do. So I always say there's a lot that we do, but there's still so much that needs to be done. So here's, somebody asked earlier, I think, for contact information. Here's our website, our general phone number. I'll also in the chat put my phone number and my email so you can contact me directly as well. And I'm going to stop sharing this real quick so I can see you. All right. So I know that was a lot. Hopefully I didn't put you all to sleep or bore you too much. But if I know there's questions, Sue, did you want to field them to me?
The only real comment I saw, I was going to have Marcus actually. I'm not sure I understand. Oh, well, there was one, I'm sorry, Marcus's was, do you advocate to those whose income is low and landlords do not lease to them? That wasn't the one I was thinking, but yes, could you add?
Yeah, definitely. I will say we did a little bit more of this in the past when we had an elder rights attorney who was able to, you know, kind of spend time on some of those things. We no longer have an elder rights attorney. We have, he retired. We have an attorney now, but she works more with like our compliance stuff. And then when we had the home choice program, you know, we got really involved in finding and securing apartments for people and kind of working with landlords and things like that. At this point, other than making like referrals, that's pretty much, I would say, what our capacity is at this point, is we make referrals to like legal aid or some places where they can turn for free legal advice.
The one that Marcus wrote that I wasn't sure what, so it's what are the areas of service caregiver has to give to the one who needs care? Not sure. Marcus, could you?
Yes, please. I mean, like there are in-home caregivers who do caregiver for the family. So what are some of the areas they have to give care those in need? Maybe what are in your chart that I see, I heard that they have to tick every time what service they're giving. So what are some of the things for like personal care? Maybe they can take for a trip or somewhere else in the park. Is that all what they have to do?
Are you asking what a caregiver does, like when they do personal care for somebody?
Personal care, yes.
Okay. Yeah. So if it's, so there's kind of two different things here. So one, if I'm a case manager and I have a client who needs help in the home and I contact one of our contracted providers who will send a home health aide to the home, what they're going to do is they're going to help with bathing, dressing, cooking, cleaning, you know, any physical needs that they have, and anything kind of in their immediate surroundings. You mentioned going to the park. They might take them for a walk, but they're not allowed to transport them for liability reasons. They'll go to the grocery store and pick up groceries and things like that, bring them home to them. Now, where it's a little bit different is family members can become the paid caregiver. So in that instance, obviously they're able to do a lot more. They could, you know, drive them places and be a little bit more involved in their care. So one thing that I didn't mention that I probably should is that right now there's always been really kind of a shortage of home health aides. We've had this issue for many, many years because the pay is not great. The state doesn't pay a whole lot for someone to go out and do that job in the home. And it's a really hard job, and it's a really rewarding job, and it's a really needed job. And they're getting paid basically like minimum wage. So it's always been an issue, but the pandemic has exacerbated it and made it 10 times worse. So we have, unfortunately, a lot of individuals who are eligible for services, and we can't get aides in there to provide services. Every day we're hearing from home health agencies that are closing down because they can't hire aides because, you know, McDonald's and Target or whatever, they're hiring people for 20, 25 bucks an hour. And the home health agencies, you know, they're getting they're only getting paid like $16 an hour. So they can only pay their, you have overhead costs and stuff. So they're only able to pay, 10, 11, $12 an hour. So just keep, being able to compete is really hard. So right now it's really, really hard for us to find home health aides for people who need it. There's a lot of people. We have, I think 600 that are on a waiver, but they're like on a waiting list to try to receive a home health aide. So we're really encouraging family members and friends who are already doing things for people in the home to become that paid caregiver. If they're already doing it, let's get you paid. It's not going to be a lot, but it's going to be better, better than nothing. So
yes. But,
did I answer your question? I'm sorry.
Yes, thank you.
Okay.
And they are happy because they are helping their own family members, and at least they get some.
Exactly.
At least
Exactly.
the wages less, still they are happy.
Exactly. Definitely. Yeah, Terrence, I see your hands up.
Afternoon, and thank you. I appreciate this, the information, and I have taken advantage of some of the services that the area aging agency on aging has here in the Akron area. So for my mom, so that's pretty good. I got two questions. One, the first one is related to like policy, right? Because we have a lot of services that are being offered and made available. And on one hand, it's almost like a Band-Aid to some degree, although they're awesome service, but it's a Band-Aid because a lot of the challenges and problems that the elderly have is related to systemic factors. And so systemic factors have to be changed by policy. So I was wondering if there's anyone inside your agency that really looks to help change impact policies around this issue.
Yeah, definitely. Advocacy is a huge part of what we do as an organization. And all of the AAAs, we actually pay for an entity called O4A, which is Ohio Area Agencies on Aging Association. And these are individuals who will go to the state and go to DC, and fight for our consumers and what they need and everything. Yeah. Because internally, like for the AAA, the only thing that we can really do is try to impact the Ohio Department of Aging, who, does make some of the rules for kind of what we can and can't do. But truly, it's a bigger, it's a really like a nationwide issue. And needs to be, fought like kind of at a bigger level. But yeah, we constantly are calling our local representatives and, just making sure that those in Ohio that make those decisions are aware, of what the needs are of our consumers. Definitely. And we also a lot of times will provide that information to our consumers and say, hey, we're going to start calling our representatives. Here's their information if you want to call too, because they love to hear right from the source. They want to hear what's going on and what the needs are.
That was tied to. Go ahead. I'm sorry.
Oh, sorry. I was just going to say, and recently we had what we called provider roundtables, and all of the area agencies. We had individuals from all over the state and all like our local legislators and everything. And each AAA kind of had their own roundtable where we invited them to come to a Zoom call, and we presented, the issues as the AAA saw it. We had consumers from the community on the calls to say, here's my needs that aren't being met. Here's what I need. We had providers on there as well to say, we're really struggling. We can't hire people because reimbursement rates aren't high enough, all those kinds of things. So yeah, we do as much as we can to kind of get the word out there and to make sure that those that make the decisions kind of know what's going on.
That's good. That's kind of tied to my second question too. And so for people who are interested in that and supporting that effort, a way to tap into that. And then the other question that I had was that's kind of related is the contracted providers. How does one also become a contracted provider who offers services, especially around like the mental health and grief and loss and things like that, to to those individuals who may need that type of support, whether it's in a live format or even in a video format?
So I'm going to put my phone number and my email address in there. So give me 1 second here. Then you can contact me and we can, I can get you to the people who can answer questions about like becoming a provider and all that kind of stuff. So, and I think I missed the other part of what you said.
I think it was tied to the lobbying piece and becoming advocates and how does one be, join
Oh.
in that effort to participate and support that?
Yeah, definitely. And if you don't, if you're, I don't know if you're on social media, if you want to like follow us on Facebook or go to our website or whatever, a lot of times we'll have information on how you can get involved, definitely on our website. And then every once in a while, depending on what's going on in the political environment, there will be like a big push for us to get, certain information out to people. And we'll put that kind of stuff like on our website and on Facebook and things like that.
Thank you.
Thank you.
And Brandy, Gay Carter, I see your hand up and I don't mean to jump in line in front of you, but could we just take this opportunity to just reinforce what you said earlier about the senior services levies and our counties compared to what's even in our own state, just to reinforce that with everybody, because we do have a lot of active community members on here and we need all the help we can get with that.
Definitely. Thanks, Michelle. Yeah, it's truly the best way to bridge that gap. And a lot of counties are doing it. And unfortunately, our counties just haven't gotten on board quite yet, but we're hopeful that in the near future that we'll get there. So Gay, can you have a question?
Yes, Brandy, I have a question about your one coordination program. Anyone that's over 60 can sign up for that program? That's on Medicare, or over 65 can sign up for that program?
Which program was it, did you say?
The one coordination program?
Care coordination?
Yeah, the care coordination program.
Yeah, so care coordination is kind of what our AAA is doing to help bridge that gap. So this is a program that we use some state and local funding to provide services for people who need them, who don't qualify for Medicaid. So they have a little bit higher income, maybe they're a little higher functioning as well. But again, like I said, the bad thing is, we just have a very limited amount of funding for this program. There's currently, I think, 310 people on it, and there's a waiting list of like 600, I think. But we do score the individuals on the waiting list according to need. So those with higher need, kind of have priority. So as, funding is available and as people transition from that program, we kind of look at that list and go by the scoring. But yeah, so anyone who would be interested in that particular program, definitely give us a call and we can get them on the list and hopefully at some point in the near future, get them services, or we can get a levy and get them on there. So
also, I was looking at the Healthy You and Steady You workshop. That program sounded interesting also. Could you explain that one a little bit more, please?
Yeah, so these are our evidence-based programs that came from Stanford University, and a lot of the AAAs have begun offering these programs. So what we do is we have a couple individuals within our AAA that are trainers, but we also like to partner with people throughout the community who want to get involved, want to do something for their community. So we've got people that we call them lay leaders who, will get a group of people together and do this training. What's nice is we have a really cool train the trainer program. They give you supplies. They tell you, exactly like week 1, here's what you do, here's the course. And, so it's a really great, they're really great programs. They're all a little bit different depending on the program. Some are, like 9 weeks and some are like the last one I think is like 16 weeks long. People will come once a week for a couple hours and there's a lot of training that they receive. And then there's also a lot of activity as well. They're all programs that get you up and moving. There's a lot of things that are able to be done in the seat, or if you can stand, there's like different activities that you do kind of as a group. It's just really cool. But yeah, and if you want more information on that, definitely email me and I can provide that information.
Okay, I'll email you about it. Thanks, Brandy.
And there are online options too, right?
Yeah.
For people who can't. Yeah.
Yeah, I think they're all online right now, but we're hoping to get back in person soon.
Hi, Brandy. This is Terry. I'm a case manager at Western Reserve Area Agency on Aging and for Care Source. I was just wondering about this. I saw something on one of your slides about helping with guardianship. So I have an elderly lady. She is in an assisted living and she has no support system. And so really she needs a guardian, but they don't want to pay for that. Do you have any suggestions about that?
I would contact your ombudsman program.
Okay.
Yeah, because our ombudsman generally will get involved in those kind of situations and advocate for the person, you know, to get the help that they need or the guardian that they need. We've gotten involved where people have had a guardian that wasn't acting in the best interest of the person, and
Yeah.
you know, able to kind of get them a new guardian. And we've also had situations where people had a guardian that really didn't even need one because they're, you know, very cognizant, you know, alert and
Yeah.
oriented and able to make their own decisions. And we were able to help get that kind of reversed too. So I would say, yeah, utilize your ombudsman department. That's a good place to start.
So one more question, like I've had members who were in a SNF who needed the ombudsman, and I just called the regular ombudsman's number. Is that different than the AAA ombudsman number or department?
In your area, it is. Your
Okay.
ombudsman is a separate entity from your AAA.
Okay.
Yeah, so ours is all kind of housed within the same building and everything. So yeah, one number for us kind of can get you there, but for yours, unfortunately, it's a separate number.
So I'll call the regular ombudsman line in our county.
Yeah.
Okay, cool. Thank you so much.
You're welcome. And if you need that, email me and I can get it for you.
Okay, thank you.
Okay, you're welcome.
So Marcus has typed in a question, wondering if you could explain the difference between Ohio Home Care and My Care.
Yeah, so Ohio Home Care is a waiver for individuals under the age of 60 who are on Medicaid. So just have to be low income and have that physical need. My Care is for individuals who are over the age of 21 who are Medicare and Medicaid. They have to be dual eligible. Same type of services, still get a case manager, all that kind of stuff. It's just the only thing that's different is the payer source, really.
Thank you. Thank you very much.
You're welcome. You guys are a great group. I love these questions.
I know, right?
Sometimes people just look at you like, I don't know.
I guess before while other people are thinking maybe if they had any other questions, one of the things we try to emphasize a lot because it's so prevalent is, you know, what happens. Okay, you occupy that space between the bridge. You are the people who make too much money to qualify for Medicaid, but you don't have enough money to pay for services. Could you describe sort of how the trajectory of how that money and then sort of the ending up on Medicaid kind of thing, the typical sequence like that?
Yeah, so you know, a lot of what we do is actually Medicaid diversion, because if you think about it, Medicaid, it costs states a lot of money, right? Medicaid is very expensive. It's the biggest budget item, I think, in the state budget is Medicaid. Most people don't necessarily want to go on Medicaid, you know, and as a community, when people do, you know, those that are working, taxpayers are paying for it. So if we can divert people, if we can keep them from becoming Medicaid eligible to begin with, that's going to be better for everybody, right? So a lot of what we do is just, you know, kind of talking about the different options and things. With especially if, you know, with our coaching programs and things where we can work with people when they're in the hospital settings and kind of get them set up with, you know, a little bit of help before things get so bad to where they have to, you know, get on a waiver program. That's the best scenario for sure. A lot of times what'll happen is someone will need a little bit of help. They're not there yet. They don't qualify for services. So we'll get them on our care coordination program. And then if they're on there for any length of time and, you know, end up, maybe they need more services than what the care coordination program can provide. So they're maybe paying out of pocket, then all of a sudden they find themselves eligible for Medicaid because they've spent down. So a lot of times what people need to do in order to qualify for more services is spend down some of their savings. You see this a lot in assisted living as well. You'll see people who have really, you know, have saved a lot of money. They're in assisted living, privately paying, and then they run out of funds. And thankfully, because of the assisted living waiver program, a lot of people can stay in that facility, in the place they've called home for so many years. And the waiver, Medicaid waiver, will then pick up, you know, the payment for them. Doesn't happen in all cases, but it happens, you know, quite a bit now, which is great. So just, you know, most of what we do is just education on, you know, how to, if you're somebody who's really close on the border, we'll give ideas on how to, you know, appropriately spend down so that you can qualify. If you're someone who's not close to that border at all, we might give them some suggestions on, what to do so that they don't have to get to that point. So.
And we do have later in one of our lectures, we have actually a little bit more concentrated talk on the Medicare, Medicaid too. So
yeah, it's a lot. It's confusing, but yeah. Oh, Terrence, yeah.
Okay, back. So in one of my former lives before retirement, I worked with the Office of Community Schools, and there was one of the schools that opened up in Cleveland was called Intergenerational School. And it was an awesome program where it allowed the elderly and the elementary school age children to be in the same environment and actually work together in terms of storytelling and math or whatever. So it provided a really good, healthy learning environment for kids, and a great opportunity for the seniors to continue to participate and have value in their lives. So I didn't see any programs that were related to intergenerational kind of activities that we can incorporate our young people into these kinds of environments to help them see the value of the elderly, and then back and forth. So is there anything like that I missed, or is there something that's planned, or is that something that you all would be interested in?
Yeah, that's definitely a really great point. And currently there isn't anything that the state, provides funding for, according to, that would incorporate those different age ranges. But I agree with you, that's super important. But one thing, and we would be interested if we could figure out how to make it work. One thing that is available though is adult day services. And a lot of our adult day service programs will do that. They'll have kids come in and do activities with the seniors, and make them cards and color pictures and different things, and come in and visit, because they do see the value for both generations actually. Yeah, that's a really, really great program, or a really great thought. And I agree with you, Terrence, that we need to do more of that. I think that's awesome.
One thing that's big challenge right now in Akron with the schools, and we just fought off a strike, but when we talk about youth behavior, this might be a way to provide a relationship with the community, and this one in particular, to help curb some of that, and provide students with some avenues to assist with that. Because once they're involved and they're engaged, you get a whole different kind of a kid coming. So
Amen.
I think you're on to something there, Terrence. We have like the big brother and big sister program. We need like a grandparent, which we do have the foster grandparent program, but like we need, programs like that where you could kind of adopt a wayward teen, And honestly, yeah, there you go. Are you offering? Well, and the other thing that, as an aging network that we've really been trying to do over the years is kind of break down some of those stigmas and the stereotypes on aging. Like there's the myth that, when you get older, you can't do anything for yourself, and you're going to be just sitting around. You can't go anywhere. You're not gonna be able to travel, not gonna be able to do anything. And that's not true. There are a lot of people who are aging and who are still very healthy. So we really try to, and a lot of people who are retired who still give back quite a bit, people who are making a difference and who are making changes and stuff. So, and I, in thinking about your idea for this program, I think that would really help. The more that people were involved in, with the older generation, I think they would see, more of the value. I think that would help with some of that.
Before I retired from Akron Public School, I had a dance off with the students. They realized, don't challenge us.
Does everything have to be government funded or financially funded, period, in order to be put in place, like what Terry was just talking about? Can't a program be put in place where people just volunteer to do?
Yeah, they could. Yeah.
Yeah.
I think we totally could. We just haven't, I don't think, seen that as an option, or haven't, done anything with it or tried to get anything like that up and running. But yeah, you're right. There are a lot of people and a lot of programs that could be, well, and I don't know as much for the kids, but for those in high school, I know they have to do, you know, community service type hours. It would be really great to get I think the biggest like hurdle, which isn't even that big of a hurdle for like us, would be, you know, if someone wanted to you know, visit some of our people on our programs and maybe do some things for them around the house or whatever, is just some of the payer sources get a little funny about people who are not a contracted, bonded, you know, background checked, whatever person coming in kind of thing. So if we could get through, you know, jump through some of those hurdles, that's only, you know, the only issue I would foresee, but I think that's doable.
That's what I was thinking as you were talking about doing a program like that, even if it was fully volunteer, you still would have to have a sort of a coordinator of, you know, at least one person to coordinate, and like Brandy said, background checks, like, and so that's some of the systemic stuff, Terrence, you were talking about, right? Those are real obstacles that keep you from doing good.
You guys would be amazed. There was a group that reached out to me of college students that wanted to just, you know, make phone calls to individuals during the pandemic. And we had to jump through so many hoops just to make that happen. It's like, they just wanted to be a friendly caller, just to check on people and everything. And there had to be, you know, training involved and background checks and all this stuff. And, you know, eventually they're like, well, we just wanted to kind of volunteer to do this. We don't really want to do all this stuff. So like and you're right. We kind of shoot ourselves in the foot with some of this stuff. There's not enough funding to cover all of these things. And we've got people willing to do them, but then we make it too hard and they can't do it. You know what I mean?
Right. Mm-hmm.
So you're right. It's systemic, and it's definitely policy issues that are hard to change.
Yeah, because if we're waiting on and a lot of things, you know, everybody wants to get paid.
Right.
Everybody, I know it takes money to live, but, you know, it was just a thought to me that people need help.
Mm-hmm.
And if we're always waiting around for somebody to fund something or get paid or to do, then people are dying. And, you know, having lived miserable lives when, you know, because I look at myself, you know, I'm retired too, but I still have some life in me where I can help children, or I can help, because I'm becoming more of a senior than, you know, I'm starting to feel these seniors now. You know, we used to laugh at them and say, well, you can't do this, you can't do that. I'm kind of one of them now, but we all need help. And I'm not one of those that you got to pay me to do everything. And I know I'm not by myself. There's a whole lot of people. We just don't know where to go, how to get started or whatever. So I just thought, you know, that might be something that we might be able to do.
So I think you and Terrence need to, you know, kind of get together and create this new program. I love it.
Well, I'm going to say this, it would not be the first time, right? So that through this forum with our GRC, we have actually come up with new projects. So don't, you know, if this is something that's a passion, don't let it die, and we'll keep talking. We'll be together for the next couple months. So
okay. Sounds good.
And truly that's the biggest benefit I see of this program. That's what I love about it. It's just, you know, getting a bunch of awesome people together with really great ideas and figuring out how we can work together to make the world a better place. Right.
Yeah. How to get it done.
Yeah.
I see a couple other things in the chat. Jennings Center for Older Adults in Garfield has a daycare center. They have intergenerational activities. Primary slots are for their staff members, but great program. So there's a link there. They are long-term care and have independent and assisted and nursing home care. And then Elizabeth wrote in, so very true. People really need to help. We have to find a way. And I'm not kidding. We really have.
She's really not kidding. We
can you see the things?
Well, I'm excited. You guys can put the program together and bring it to me, and I'll pedal it. I'll see what I can do on my end.
All right.
All right.
Thank you guys so much. That was great.
Thank you, Brandy, for presenting with us today.